welcome to a special edition of Southern Remedy. I'm Melissa Faith Payne.
And I'm Dr. Rick DeShazo. Thanks for joining us.
Well, the Affordable Care Act, also known as Obamacare, reforms the health insurance industry by increasing benefits for policyholders and by providing a marketplace for the uninsured to shop for health insurance coverage. Tonight, we'll focus on how the Federal Health Exchange is affecting Mississippians.
The new law reforms the health insurance industry, but what that means is not well known. What we do know is that saying Obamacare can get opinions flying.
From what I understand, I think that it would be people that normally don't have insurance, or insurance not offered through the job, or maybe can't afford the insurance.
I think it's too bad that the president's website was such a mess. I think that's just a terrible fiasco, but hopefully they'll get that all worked out. And it's just like Medicare in the 60s. Everybody was like having a fit over that, it's going to bankrupt the nation, and now, don't you touch our Medicare. So I think it's going to be a good thing ultimately.
I don't like it. I don't like it. I think it's ridiculous to make somebody have health insurance when, we're from the South, and most of the people from the South, they do home remedies. My grandfather, he'll tell you in a heartbeat instead of having surgery, he'll tell you, go do this and it'll help you. And most of the time it's right.
To me, I think the Obamacare is something to help people that's unable to help themselves. You know what I'm saying? Like, far as people that can't afford things that other people can.
I don't know anybody personally who has signed up for it, but I'm an advocate of the ability for all Americans to be accessible to insurance coverage.
Well, here are three of the basic benefits of the ACA. Young adults can stay on their parents' insurance until they're 26 years old. Lifetime limits and caps are removed, and insurance companies must cover preventative services. Also, in 2014, insurance policies for individuals must include the 10 essential health benefits. Now, Dr. Rick, let's take a look at the first 5 of those 10 essential health benefits. Now, the first 5 are ambulatory patient services, and that would be like your doctor clinic visits. Also, emergency services, hospitalization, maternity and newborn care, and also mental health and substance use disorder services, and that includes behavioral health treatment. So as a healthcare provider, talk a little bit about what this means for patient access.
Our biggest problem as primary care providers, regular doctors, is getting health services in the mental health area. We haven't had access to those services because there's been no reimbursement, and this provides that. So we're going to have all these people who've been turned out in the community with psychiatric disorders and not getting a lot of long-term care able to get that. We're also going to have a great expansion of maternity services, especially so far as preventive care, which decreases the risk of baby problems later on. And if those do occur, there's also a child health care provision that's going to be extended.
And that's so interesting to me because I am a mom. Will that help moms, and what does this mean for those moms?
Well, there are a lot of problems related to pregnancy that are easily fixable if they're picked up. Anemia, vitamin deficiency, underweight. All of these things have big long-term consequences.
And they help the mom and also the baby.
That's right.
All right. Talk a little bit about, when you're talking about these behavioral and these mental health problems, talk about what this plan means for those people who may not have had access before.
We have a major substance abuse, drug abuse problem in Mississippi. And we just haven't had a way to get these people to the appropriate addiction specialist because there's been little or no reimbursement for those services. This will get those people who are having problems with alcohol and drugs off the street, out of the places where they're abusing these drugs, and into health services to hopefully get them back into society.
And what was happening to these people beforehand when they didn't have access to these services?
They ended up in jails.
Wow, they were ending up in jail, and that means that they were ending up in the streets doing things, committing crimes and whatnot.
Right.
Absolutely. Now, as a healthcare provider, we've talked about what it means for the patients, but what about for you? What does this act mean for you?
I'm glad you asked. it means that I can go to sleep at night. Because so many times in the past, we've seen patients with these kinds of problems in primary care, and we have not been able to get them to the specialist they need to see.
All right, well, thank you so much, Dr. Rick. And we'll continue this discussion, but now LaWayne Childry of MPB News speaks to Tom Mabry about his recent job loss and about his experience with the Federal Insurance Exchange.
53-year-old Tom Mabry of Ridgeland prides himself on being a hard-working Mississippian. But when his debilitating back condition worsened about 4 years ago, everything changed.
I'm a good worker. I have done lots of quality work for people, and I've benefited several companies. I know I've seen companies grow while I'm there. I still have something to offer. I don't want it to go to waste. Back surgery kind of runs in the family with me, and it just looks like I'm due my turn of getting some repair done to the back spine area.
The pain became so excruciating that Mabry says he was forced to quit working and moved in with family. Leaving his job also meant he no longer had health insurance to cover the high cost of multiple treatments and doctor's visits.
I've had a knee operation, MCL and ACL, and I have delayed work because I can't afford it without insurance.
In December, Mabry logged onto the Affordable Care Act website to see if he could find a plan that would meet all of his health care needs at a reasonable price. After a few unsuccessful attempts, he says he finally got more than what he bargained for.
It's a silver package with a deductible of, I think it was $900, and maximum payment per year would be $14.95, I believe.
So what's your monthly payment?
Is a zero because I'm unemployed. I'm not going to complain because I've not been in that situation. This is a step closer than I've ever been.
While he knows he's been approved, Mabry says he expects his new health insurance card to come in the mail any day now.
I don't want to sit on the sidelines and watch life pass me by. I want to be involved in it. I still have something to offer. I don't want it to go to waste.
So, Dr. Rick, it looks like Mr. Mabry had some success when it came to signing up, but we have heard about some people that have not been so lucky when it comes to signing up.
The website has been a nightmare, so each person has to decide if the trouble is worth the benefit.
All right. Well, let's talk about the next 5 essential benefits and what this means for insurance holders. For instance, prescription drugs, rehabilitative and habilitative services and devices, laboratory services, preventative and wellness services, and also chronic disease management, also pediatric services, and that does include oral and vision care. Now let's talk about rehabilitative services. What on earth is that?
That's Fed speak.
Okay.
It's what it is getting you back into action after you've had a stroke or had surgery or some other medical procedure or activity. The habilitative piece of this we think will be chronic disease management. And we're hoping it'll be for kids with cystic fibrosis and other chronic diseases.
Okay, now we're talking about kids. Let's talk about these pediatric services. This includes dental and vision. Why is this so important?
Let me tell you, this is a big deal. Kids that have bad baby teeth end up having bad adult teeth and having them removed.
Right.
So this is a way to prevent a whole lot of downstream cost and not only expense, but also pain in getting your teeth removed. So that's very important. The vision services, that's obvious. If you can't see, you can't learn.
And how important is it for kids to learn these good, healthy habits early on in life?
It's really very important.
Okay. Let's talk a little bit about this preventative and wellness services. How important is that? First of all, what is that and what does that mean for these patients?
Well, that's the thing most physicians are most excited about. We spend all our time treating disease and none of our time preventing it because we don't have the resources, the time, or the support to do it. Most of the diseases in Mississippi are preventable, the majority of them, if people just know how to eat right, exercise, and so forth. So we'll now have the ability to do that kind of counseling.
Well, thank you so much, Dr. Rick. Well, do you still have questions? Mississippi's Insurance Commissioner Mike Chaney talks with MPB's Jeffrey Hess about the federal health exchange marketplace available in Mississippi.
Thank you for joining us today, Commissioner Chaney. I'd like to start, if we could, explain basically what is the health insurance exchange?
Well, the health insurance exchange is simply a marketplace where you can go and pick the insurance policies that you want for health insurance. It's similar to going to the grocery store and going down the coffee aisle and looking at 10 different brands of coffee and deciding what brand you want. It's similar to that. It's a lot more complicated than buying a can of coffee. Almost as expensive if you bought coffee lately, but you have all the plans for health insurance, whether you have a 10% copay, 20%, 30%, or 40%, or what we call a catastrophic policy that covers things like major medical issues. You have a comparison of the companies that will offer those products on the exchange on a website. Unfortunately, it is not something you can buy off of a piece of paper. You have to buy it off of a web portal, just like you would an airplane ticket from Expedia, Priceline, or Travelocity. So it's a way to compare and shop for the plan that best suits your need.
From your point of view, what's the most important thing someone who's uninsured in Mississippi should know about the exchange?
What they should know is that if they are uninsured and they are of low income, that means usually 200% of poverty or less, that's about $25,000 or less, they should look on the web portals for www.healthcare.gov and look at the plans that are offered in Mississippi, and they can get subsidies. 86% of the people that have bought policies in Mississippi so far since the federal government opened the exchange up have received a subsidy of some sort. If you're at 200% of property, you would probably pay half of what the policy would cost you in the commercial market. So it's important to go look it up, and you cover pre-existing conditions. So if you have cancer, it's something you might want to look at. We had a lady very recently, within the last matter of days, that had cancer and could not buy a policy, was able to sign up on the Affordable Care Act. The federal government now operates this exchange, not the state of Mississippi, because we were denied that opportunity by CSIO, which is part of HHS. But the lady signed up. The policy that would cover her was about a little over $700, and with the subsidies and her income, she was able to buy the policy for a little less than $3 a month. That's pretty good for someone that's not had any coverage for the last 2.5 years.
If you could explain a little more what the subsidies are and how they make the insurance that's currently unaffordable for many people more affordable.
Well, the idea of subsidies was to make policies affordable for those people that made less than 400% of poverty. You get a sliding scale. You start with a minimum amount of subsidy if you make up to, a family of four makes up to $92,400 a year. And by the way, that's more than I make, just so throw that in for you. So a family of four could get a subsidy of a few dollars to someone who makes about $11,000 a year can get a subsidy of almost 100%. They would actually put up about $30 a month at a max. So it's beneficial for those people in the lower income range. And we've recently have gotten or secured a waiver from CSIO and HHS to let people get on the exchange that make less than 100% of poverty with something that's called an emergency waiver. Originally, they were not to be covered. So it's important to someone, if you have low income and you do not have health insurance because you work, say, 30, 33, 34 hours a week, go to the exchange, www.healthcare.gov, and see what's available for you.
So that waiver would have been, those people would have gone to the Medicaid expansion, but now the federal government's going to let them go into the exchange and look for subsidized
plans? They will let them go
plan?
into the exchange. You know, the state of Mississippi has turned down about $1 billion a year to expand Medicaid in the state. The governor and the legislature believes it would increase the cost of the state of Mississippi. I do not manage Medicaid. That's an issue that falls under the purview of the governor and the legislature, and they're the ones that have to choose if they want to expand Medicaid. So it's a very controversial issue. It becomes one of ideology. It's not one about whether someone actually needs help. It's one about whether we think they ought to get help or not. I say we, I should say whether the governor and the legislature think that.
All right, well, I appreciate your time for joining us today. Thank you very much.
Thank you so much.
joining Dr. Rick DeShazo and me is Dr. Claude Brunson. Dr. Brunson is Senior Advisor to the Vice Chancellor of External Affairs at the University of Mississippi Medical Center. He's also the President-elect of the Mississippi State Medical Association. Thank you so much for joining us.
It's a pleasure to be here.
It's great to have you here with us. We understand that the Medical Association for the state of Mississippi just released a report giving health care in Mississippi a big fat F.
Yes, we did. Each year, the Medical Association, in joint venture basically with the health department, will release those health statistics. And each year, we're seeing that Mississippi is getting a failing grade. And we're looking for ways and strategies and as many people as we can to partner with to see what we can do about those health statistics. We have to do something to improve those statistics.
So what do health disparities and health insurance have to do with the health problems we have in the state?
Health disparities is basically when you have a difference in outcome among different citizens, say white citizens and Black and African American citizens. They can have the same illness such as cancer, but African Americans will have a much more severe disease and they will be dying at a higher rate than, say, the white Mississippians who have the same disease.
So that's what's actually the case?
That is the case.
We do have that
is
difference.
The case. And we need to figure out why that difference is, and we need to have treatment protocols and ways to get to these folks so that we can do something about that.
Well, let me just jump in right here and let's talk about preventative care and just how important is that. Do you want to take that?
Now, the best way to get them preventive care is to make sure that they have access to health providers, which the best way to do that is to have access to health insurance. And so it's all a part of the same continuum. We get them health insurance, they get access to health care providers, we educate them and treat them so that they can remain healthy. And the other things that we do is, as we're treating them and we're beginning to change the health status, is we need to be able to take that then from the hospital to home. We have to educate them, teach them how to remain healthy. And part of that is also going to be having access to health insurance so you can get those preventative services.
Do you find that in the rural areas it's so much harder for them to get access to health care?
It is a major problem in rural areas. Now, Mississippi, as a state, is considered to be rural when you look at us nationally. But then we have very rural areas of this rural state. We have a significant shortage of physicians per capita when you look at us compared to the rest of the country. And then we'll have even more severe shortages of physicians out in those rural areas. And so we have to find ways to get patients access to healthcare providers in those areas, and those are some of the things that we're looking at the University of Mississippi Medical Center and at the Mississippi State Medical Association.
We've heard from Commissioner Chaney that there are only about 8,000 Mississippians signed up for health insurance. I understand you got some ideas at UMC how to help with this that are actually part of the Accountable Care Act. Is that right?
It is. We were fortunate enough to apply for a grant from Health and Human Services. We got a grant worth $830,000, and we're using that, training our folks at the Medical Center to use that network that we've already have of patients across the state that we're accessing, we're educating them, we're helping them sign up for health insurance through the marketplace.
Dr. Brunson, thank you so much for joining us. Now, let's meet two ladies, one who beat cancer and who is working without health insurance benefits, the other who recently retired. Both are seeking help through the Health Exchange. LaWayne Childry has their story.
Meet 52-year-old Johnny Robbins and her 63-year-old sister, Hazel Robbins. The Robbins sisters say they do nearly everything together.
I can put it like this, by me being the oldest, me and her have been together since she was like this. So everybody used to tell me I was her mother.
For Johnny, this is the first time she's had health insurance in 7 years.
Some offer insurance, some don't. Just like the owner I have now. He doesn't offer insurance. He suggested that we get on Affordable Care because he said he didn't know was the Chick-fil-A gonna let him offer insurance. And then I know some businesses less than a certain amount of employees that they couldn't offer insurance. So I took his advice. I got on the exchange and it worked.
And for Hazel, it's the first time she's ever had health insurance, even though she's worked as a daycare teacher for the city of Jackson for more than 3 decades.
But it's very expensive. I couldn't afford it because I wasn't making a big check. So I had to do one of the two. take care of myself and my child, you know, expensive. And see, they was taking out your check every month. You know how they, when you give you your check, everything you got came out your check. You didn't do it yourself. They took it out. So you whatever left, that was whatever left. So I couldn't afford it.
The sisters don't own a computer, so they signed up for their new insurance plans on the Federal Healthcare Exchange with the help of a navigator at the Metro Center Mall in Jackson. Both sisters say their premiums are well within their budget and their plans are tailored to meet their specific needs.
I have a good plan because my plan has vision and dental attached to it. And that's what I need because I do need glasses. And so that's a good thing. And I was surprised the cost, you know. I really was surprised because I didn't think it would be as affordable as it is, especially with the dental and vision connected to it.
I am happy to have this plan also for this reason. It would help me a lot because, like I said, I have diabetes. I have had diabetes since 2003, I believe. And I have went through a lot from that time up until this time. I take a lot of it really helps me in a lot. It's going to help me in a lot. I'm amazed that I was able to get something to help me.
Only about 8,000 of the 275,000 Mississippians who are eligible to sign up for the Federal Health Insurance Exchange have done so.
You know, when you ain't got no insurance, even the eye exams are very expensive.
Dr. Rick talks with Dr. Tim Alford, a primary care physician who lives in a rural community, about the impact that the ACA has in his community.
It's great to be here with Dr. Tim Alford to ask a few questions about the practice of medicine in Mississippi and how it's affected by insurance issues. Are the patients that you see in your practice without any insurance any different than those patients with insurance as a group?
Interesting question. This group of patients is much talked about over the past year, and in my estimation have been misunderstood and in some instances, many instances, mischaracterized. In the town where I practice, in Kosciuszko, these are people that I see every day. If I go to the grocery store, they're the checkout clerk. If I go to the store, they're a store clerk, for example. They may be taking our children to school on a school bus. They are assisting our teachers in the classroom. They are doing many things in our educational system and in our economy that help undergird our economy. So to say that these people are working poor, I think is somewhat of a misnomer. I think they add to our economy, and if you ask them, many of them would be insulted that you call them poor. So a lot of these people are actually my friends. I see them on a day-to-day basis.
How is the Affordable Care Act actually going to affect these people?
Well, it hasn't worked out too well so far, has it? The effort to give these people insurance has sort of fallen on deaf ears within our own state, and the ability to get these people covered under something has been very frustrating. So what we do in our practices is what we call workarounds. When we see these patients, I know that it's going to take a longer period of time to get them taken care of the way they need. It's harder to get them their medicines. It used to be that pharmaceutical companies left a lot of samples in the office, and we used to be able to give them samples. Now those aren't so easy to come by, so we have to fill out forms, which takes time out of our practice to do those things. There are physicians around the state that I understand and have grown to develop good working relationships with that I know will help take care of these people. And so when we need consultation or specialty help, then that is a fairly closed circuit of physicians that will do that. But it is more time consuming to take care of these people, And it also puts an undue burden on our practice. In our particular practice, we have, I looked at the numbers this morning, anywhere from 5 to 10% of patients present to our clinic have no means of payment. I look across the street at our emergency room, the numbers in the emergency room are 23–24%, which tells you a little bit of something. It tells you that patients are using the emergency room as a default if they cannot get in to see us. We try not to put up a barrier to see these people, but these are proud people, and they want to pay their bills.
What about the preventive medicine and public health component of the ACA?
Primary care, preventive medicine is the best bang for your buck. Value is what we have to have in the system now, and the law for the first time places an emphasis there.
Thank you, Dr. Alford.
Thanks for joining Dr. Rick Gishezo and me tonight for this special edition of Southern Remedy. To view extended interviews from this program, you can visit southernremedy.org.
For all of us at Southern Remedy, good night.